Okay. So, hi, I'm Gayana, a global change maker from Armenia. I have not been pronouncing this so many years, so I have really missed it. First, I want to get acquainted with you and introduce myself. I have recently graduated from Yerevan State Medical University, and now I'm a radiology resident. So, today we are going to talk about a really important topic, which is the healthcare campaigning. This is kind of sensitive topic, I think, and also important topic, but at the same time, is quite different from the other types of campaigning. So in my country and in most of the developing countries, people are quite apathetic to their health. So, but the thing is that people are not born apathetic. This is just a behavior of apathy. So if we know the cause of apathy, I think we can tackle it. So being sensitive to different beliefs or motivation can help us to understand why people really behave themselves in that or in other ways. So welcome to my webinar. Just let me set my
Become.
mhm. So let's start. Yeah, when I was starting to use some materials to make some research before doing this campaign, I came up to these four steps, which is for successful campaigning. So it says that the first thing is you need to understand your needs, strengths, weaknesses, and the second thing is you need to develop campaigning strategy and plan. And the third, very important, the most visible one is implementing the plan. The fourth one is just monitoring the success of the plan. Of course, it seems very simple, but at the same time, we need to go step by step. I suggest, in order to start healthcare campaigning, use this hierarchical model, which is called AIDA, like a girl's name, but actually not a girl name at all. So A stands for attention, I stands for interest, D stands for desire, and A for action. So let's do it step by step. So first one, these issues, this health. So that's not apathy. As for me, it is mostly normal because before entering medical university or not starting clinical rotation, I also believe that many healthcare issues have nothing to do with me. So I will bring like a good example, which I have found recently regarding to the young breast cancer. So a lot of young women believe that breast cancer has nothing to do with them. That's also normal when you're 20 and 25. You can consider different healthcare issues, but not breast cancers. And at last, the second example is that a lot of people don't care about car seats or having car seats in their cars because they just don't have a child. But in order to solve to solve this issue, we need to identify an angle of the issue that connects to the target audience's experience or interest. So that's why I suggest to put a headline and a picture of young women who enjoy their life and found out that she has a breast cancer, or something like this. I wrote this picture like I think I might be pregnant just because we never know our health status. So that's why we need to pay attention to. I mean, you need to do by your campaign. You need to bring attention of your audience into their health. So I have recently found this really nice campaign, which is about fastening the seat belt. So the listeners so that this is all about fastening the seat belts, and the people just survive visibly. You can see just survive just because they have fastened their seat belts. So the second letter is I, which is stands for interest. And a lot of people think that campaigning is boring, because everyone is doing healthcare projects, implement healthcare projects, do a lot of flash mobs, and you really need to be unique and you need to be alternative. So first of all, please target your audience. Of course, there are a lot of ways to targeting the audience, but I suggest to divide your audience into two groups. The first one is people who are directly connected to the campaign. For example, you do a campaign only for pregnant women. The second one is people who ought to be connected to the campaign, like everyone should know about HIV prevention or about some infection disease and etc. So that's why, in order to catch the interest of people, we need to point out to the audience how they are being affected or having an effect. I have brought a good example, which I have seen myself recently in my country too, and in some of the countries when we are monitoring carbon monoxide level of a smoker and non-smoker. It's okay to have a small amount of monoxide in your breath, even if you are not a smoker. But if within the frameworks of this campaign, we show the real difference, the real level difference between smokers and non-smoker. So then we're going to the next letter, which was D for desire. So people are told alternative campaigners or health promoters need to show the audience what the better alternative is to make them want it. So this is kind of a sensitive part of your all campaign. And then we are going to the A, which is stands for action. So sometimes people really do understand their health problems, but they believe that they can nothing to do with it. That's why we need to show the audience what they can do, giving them information and materials they need. So action, when you came already by this hierarchical system, came to an A for action. That means that you already made people go to do some medical checkups, to do blood tests, for example, or an X-ray, and etc. So I just put an X-ray because I'm a radiologist. So now we are going to topic decision. When you are starting a campaign, you need to choose an appropriate topic. That's why sometimes people ask me what is the most comfortable, let's say, topic. So my advice is to be sure that that your topic matches the time. For example, if you do a flu campaign, firstly you need to understand that you need to do a flu campaign just before the flu season, or plus you can also support your national campaigns. For example, in my country right now there is a campaign which is a no-smoking campaign for banning smoking in the restaurants. And of course, if you do this kind of campaign as your national strategy, you will totally support them. And your topic should be very well known by yourself. I mean, you need to master the topic. That's why if you don't, please also include health experts, doctors, even medical students, or NGO leaders, or health program leaders who can really help you with this. So, of course, when you have already chosen the topic, it's the most visible part is the name of the topic, which will help you to get the attention of your audience. That's why when you are choosing a name for a campaign, try to be catchy and simple. When trying to come up with a name for your campaign, it's a good idea to use a name that distinguish it from any other campaigns you have created before or your friends created before. If you're struggling to come up with a name, think about what the campaign is being created for. So there's also one important thing is to choose the language of the campaign, because it's okay for the English speaking countries, but there are a lot of multilingual or bilingual or at least multilingual countries. That's why before choosing a name, also monitor the expectations of your target and choose the language which is like, let's say, catchy for your audience. So then we are going to the most interesting part for me and maybe for all of the healthcare promoters, which is the implementation. So if there is evidence to believe that your campaign might benefit the people, I mean your campaign totally matches to the time and you have chosen a good name. So next step is to assess the current situation of your country. Valuable resources of information can be representative of Ministry of Health or experts, NGOs working with in healthcare field, and try to understand the statistics in your country too. Then one is marketology too. When you're starting, before starting the implementation of your campaign, from your target audience. For example, when you are trying to for example, you are making a poster for pregnant women, so you can form a focus group of like 8 to 10 pregnant women and to show them and to understand how attracting your poster or your advertisement or your text and etc. are for them. So the target group from your focus group from your target audience will help you to be more and more attractive. So implementation to there's one kind of very simple for us to choose to do an online campaign or an offline campaign. But what is most important is to combine science with whatever you do and always refine the process with the experts. So let's start with the media because plays the most important role in nowadays life. So the role of effectiveness of campaigns using firstly, when you're using mass media, it will help you mobilizing and supporting local agencies and professionals who have direct access to individuals within the target population. The second one is bringing together partnership of public voluntary and private sector bodies and professional organization. The third one is that you inform and educate the public, but also set the agenda for public debate about the health topic, thereby modifying the climate of opinion surrounding you. And at last but not the least is the encouraging local and national policy changes as to create and support environment within which people are more to change their behavior. So friend also has its own challenges. So the first one important challenge is that when you're using social marketing for health promotion, it is unlike traditional marketing where money is exchanged for a tangible item and the related are immediately. The benefits of positive health behavior changes are often not noticeable for a long time. The second one is that another limitation for your social media pertains to digital divide in the population. You know, when you are doing a socially disadvantaged groups for that campaign for socially disadvantaged groups, you often sometimes they do not have an access to the new media or social networking due to language or literacy disability or some technical barriers. So that's why you may face some difficulties with social marketing. And also another limiting factor is that sometimes people really, as there's a lot of information on Facebook, on all the social media regarding to the health. So sometimes people really do not trust what they see. So that's why my advice to you is to combine science with online and also offline marketing. So considering all the challenges regarding to the healthcare regarding to the online campaigning, we need to understand at last when to use the media. Firstly, when you need to use media when wide exposure is desired, when the time frame is urgent. You know, mass media offer the best opportunities for reaching either large numbers of people or specific target groups within a short time frame. The third one, public discussion is likely to be educational process. So I believe that media messages can be emotional and thought thought-provoking because of the possible breadth of coverage. They can be targeted at many different levels, stimulating discussions and thereby expanding the impact of message. So the next one is when awareness main goal. That means that by their very nature, the media as awareness raising creating tools. So that's why a health issue is an important to its resolution. The mass media can increase awareness quickly and effectively. The next one on the question is when to use the media is when long-term follow-up is possible. So most changes in health behavior require constant reinformers. Media programs are most effective when the opportunity exists for a long-term follow-up. This can take the form of short bursts of media activity over an extended period or follow-up activities unrelated to media. And at last but not the least, when the behavioral goal is simple. So, for example, all the complex behavioral changes such as smoking cessation or exercise adoption may be initiated through media programs. The nature of media is such that simple behavior changes such as immunization or cholesterol testing are more easily stimulated through the media. In general, the more complex the behavior change, the more backup is required to supplement a media health program. And at last, when the agenda includes public relations, I mean that many, if not most, health promotion programs have an agenda which is not always explicit, maybe to gain public support or acknowledgement or to raise funds for further programs, where public relations are either an explicit or implicit program, mass media are effective because of their wide-ranging exposure. So I have already to bring some examples of animation and videos, which is very well used. Video marketing is now used in all the industries, and healthcare isn't an exception. Using video marketing can help patients or your audience feel important and connected. Here are different types of videos in healthcare industry using to attract and also educate people. For example, there are the testimonials. Everyone loves to hear success stories or success stories, but at least some personal stories. The testimonials connect with people on an emotional level, which helps potential campaign. The second one is welcome videos. It's very important to have some kind of welcome or introducing videos when you are doing a campaign in order to show what you are going to what your mouth. And the third one is that physician profile. All about the campaigns are going to include the doctor. Incorporating profile videos on a healthcare campaign website is a wonderful way to introduce your physician or your doctor to your audience, and this will increase the trust to your healthcare more and more. So, and of course, there is importantly, it doesn't matter you are choosing an online campaign or an offline campaign, you need to network and again network with people. So that's why when you are doing a campaign, firstly find opinion leaders or so-called influencers. You need to make a search, you need to monitor people like opinion leaders in your community or in the communities you are going to make your campaign, to organize your campaign. So the second group of people you need to include in your campaign are the marketologists, event managers. Of course, if the campaign has a really big budget, you need to hire these people because they know some tools of neuromarketing. They know how to make the design of your poster. These are the ones who are making your campaign more visible and more attractive. So I have brought an example of a celebrity, Victoria Beckham, who is struggling with stigma and discrimination for people. She's trying. I mean, her priority is to reduce the stigma discrimination for people living with HIV. So if you really have such network to invite the celebrities, or I mean, just try. My advice to just try to send them letters and maybe ask them to participate in your network in general. So there is going to the when you are young and health promoter and you are the starting everything from the beginning, you have never tried anything, at last you are just a student, you can do a campaign with zero budgeting. This is a good experience from me and from my friends, so quite usual when you are students. And frankly speaking, all great ideas once started with zero budget campaigns, and I, me and a lot of my friends zero budget campaigns many times. My advice to you in this case, when you are not about to do any fundraising or you don't know how to do it, is to first find friends or just people who are interested in your healthcare campaign topic. So this works, of course, this works easier when you are a medical student. Some campaigns really don't need any budget. For example, I have recently found one of the campaigns of my friends, the students of medical university. I mean, they are medical students, and together they are really great guys. They form a group, they draw their own poster which will catch attention of people, and wrote like skin cancer or melanoma. And they also got some help from their own tutors from university, like dermatologists who helped them to just do an examination on the street of people, and they were examining the skin birthmarks of the people and trying to understand the possibility of malignization. So this was a really cool campaign of skin cancer and melanoma. But at last, the network, which was it will, even though you have a budget, it will also skip. I mean, help you to skip a lot of money wasting. So and then we are going to the evaluation. Evaluation is very important. And we think that we need to do an evaluation as a last point for the whole program, but you need to do an evaluation from the beginning, based on your tools and tactics. Consider from the beginning how you are going to measure your effort. Metrics need to be tracked and how you will do that. It usually happens when you are so focused on whatever you are doing and you get excited, pull the trigger, and suddenly there is no system in a place to track the results. So first understand how you are going. This is need to be your first point campaigning, because this will show the main your effectiveness and that of your wall. So this is it. Together we make this world really happier. Now I am going to check the questions. I have a lot of people saying hi. Hi to all countries. I am sending you highs from sunny Armenia, even though it's evening in Armenia. But I also received several questions regarding to the when you were registered. I also received several questions. The first one is for the sustainability. Let me check. So I have received a question regarding to the sustainability of healthcare. I mean, of healthcare campaign. So the thing is that when you are doing an awareness healthcare campaign, it's kind of tricky to find out how you're going to measure the sustainability. So that's why my advice to you is to cooperate with hospitals and polyclinics. For example, when you are doing a healthcare campaign, awareness raising campaign, so please ask them, always the doctors or some healthcare representatives, ask them always to remind their patients about your about the main message of your campaign. I have also received a question regarding of smoking campaigns. This is kind of one of those campaigns which are not only just a healthcare issue, but it should be also my advice to you when you are starting a non-smoking campaign, try to work with your government, try to work with the Ministry of Health or some really network, at least with so that's why I mean your message should be sent to the policymakers, not only to the population, not only also the government makers. That's why please include all of them. So, and I also received a question regarding to some drug addiction. So my advice to you is to make a lot of can drugs destroy and damage your health. So yes, I think this is it regarding to that question. If you have any questions which you have sent me before, I promise to to text you on inbox. You can follow me on Facebook or on Instagram and text your questions regarding to the healthcare campaigning. So this is it. I was really happy to host this webinar. So one more time, together we can make this world healthier.